Interesting topic. A lot of people have tried dieting to get fat off, and there are certain fat cells that just will not come off. So they have developed a technique called fat suctioning. We're going to talk about that today because it has been in the news quite a bit. We'd like to know more about it, so we have invited Dr. Michael Wojtanowski from the Ohio Clinic for Aesthetic and Plastic Surgery to join us. Good morning, Dr. Wojtanowski.
Good morning, everybody.
What does one do when one does a fat suctioning technique?
Basically what we do is a nifty little procedure through tiny little incisions where we remove localized areas of fat accumulation, which are diet and exercise resistant.
So that's very important because there are ways to get rid of that. And this isn't for everybody, is it?
Absolutely not. It's for the patient who has really made an effort to get rid of those unsightly bulges, either with dieting or exercise, and they've really had little or no response.
A lot of people would love to say, hey, why don't you just come and vacuum my fat away? Right? How many of you would like that, huh? Just perfect body. Does it work that way?
No, it really doesn't work that way, and we have to assess patients appropriately so that when we do the procedure that their skin will contract, because it's not a skin cutting operation. It's an operation on the fat that's under the skin, so that if somebody is diffusely obese, obviously we can't remove all the fat cells. It wouldn't be safe and it couldn't be done.
After it's done, do you have to tighten up the skin or no?
No, if we do it on the right patients, and that's where patient selection and doctor judgment come in, if we do it on the right patients, the skin will contract appropriately and the silhouette of the area will improve significantly.
Is it cellulite or cellulite?
Whatever.
Either one.
Right.
What is that and where does it go?
Cellulite is a term that is misjudged, and basically cellulite refers to skin and the changes in the skin surface that cause the rippling and the dimpling. It really does not refer to the fat that's under the skin, and that's what we remove when we do suctioning. Not the cellulite, but the fat that's under the skin.
Is there no way by exercising that you get rid of those fat cells?
Certain areas are really exercise and diet resistant, and some of those areas include the outer thigh in females, the male breast, the male love handle, sometimes the double chin. Some of those areas just don't go away no matter what people do.
Let's look at some of the procedures you've done here, all right? Because you've picked out a couple of those areas that really... Now,
what you want to look at here is the hip and the outer thigh region. And essentially what was done, and you can't even see the incisions because they're very small, they're only about a quarter to a half-inch small, 2 on each side. And what we do is we sculpture those full areas so that people look better naked, but more importantly look better in their clothing. This is a patient who lost probably 2 to 4 slack sizes. In other words, people who have these problems, women especially, who have the saddlebag and the hip fatty areas are bottom heavy basically, and what suctioning will do will reshape that area so that their clothing fits in a better manner.
If you have any questions about this, call us 578-0707, all right? 578-0707 if you have any questions about fat suctioning. Let's take a look at another picture right now, and you get an idea of another area of the body where you can have some improvement through this procedure.
All right, this is a patient who looked almost matronly because of a double chin, and a simple small incision under the chin and removal of maybe about a tablespoon of fat has allowed her skin to redrape and give her a better contour and a better jawline.
And
no facelift was done here. This was
no, you didn't have to tighten this. You didn't have to make an incision.
It contracted
other than to get the thing in there.
In the right patient, it will work.
How long does a procedure like that take?
The chin suction takes about a half hour and about 5 days of early post-operative healing.
And cost?
Cost varies from $750 up, depending on what kind of procedure people have and how many areas that are done.
So you can get your new Bob Mackie dress and your new fat suctioning. You'll be all set. You'll be poor for the rest of your life. No, that's not really bad considering the cost of many plastic surgery techniques.
Right. It's really, suctioning has revolutionized body sculpturing, not only from the cost point of view, because it's less expensive than the standard operations that we used to do, but also because we do most of these procedures as an outpatient so that the hospital or the operating room costs are less.
So you don't have to check in here?
Not usually, no.
Okay, let's take a look. You got one more picture right here that we're going to show you.
Right.
And this is another procedure.
This is just to illustrate that suctioning has also allowed the male plastic surgery patient to have some things done. And this is the love handle, so-called, that many, many men have. This is a gentleman who weighs about 130, 140, appropriate for his size. But no matter what he does, exercise, etc., those little love handles won't go.
Oh, look at that.
Through a small little incision in the back, we can sculpture that fat area out and allow a change.
That's before, right?
Right.
And then we'll take a look at after.
There you go.
And there it is.
The other area that we can do on men, and the area we do most commonly, is the flank behind that love handle area, and also the male breast. There are many men who, for whatever reason, will accumulate some fatty tissue in their breast and that can be removed with a suction technique.
Is this permanent, or do the fat cells come back?
If it's done on an area that's exercise or diet resistant and people maintain their weight relatively stable, then it shouldn't come back.
But it could come back if you just ate like a pig.
Well, obviously, and usually the same deformity doesn't come back, though. When you gain 10 pounds or 15 pounds, it's a diffuse weight gain as opposed to the bump that was there in the first place. So often the deformity won't come back. You may get some fat back in that area, however.
That is fascinating. Let's take a phone call right now. Good morning. You're on with Dr. Wojtanowski.
Yes, I lost like 40 pounds and I exercise 4 times a week, but my legs are still really, really heavy. Would that be a candidate for the fat suctioning?
Okay. This brings up a good point. Fat suctioning is not a procedure, is not the only thing we do as an isolated entity. We often will combine that with other operative procedures, and it sounds like what you're talking about is excess skin and fat. So a combination of suctioning and the standard body sculpturing techniques whereby we remove skin and tighten skin would probably be ideal for you. And we do that very often. We combine suctioning with facelifts and tummy tucks and thigh lifts now to even improve those results over what we used to be able to get.
Does this matter how old you are?
It matters how old your skin is, the quality of your skin. I mean, we have done suctioning on people in their 60s and 70s who have very good quality skin. Obviously, the younger you are, the better your skin quality is in most cases. However, age is not a contraindication. It's on an individual basis.
Because some people at the same age, for example, would have younger-looking skin, as they say in the commercials, right?
Right.
And they always get those people to do those commercials who have that younger-looking skin, too.
Wherever they are.
Right, wherever they are, just thanks to genetics. Let's go back to the phone. Good morning. You're on with Dr. Wojtanowski. Hi.
Good morning. Would you please discuss some of the problems with the procedure as well as the need of fat in both men and women to protect from bone injury? Thank you.
Okay. With respect to the need of fat, the fat that we remove with this procedure is fat that you can do without, so that in terms of injuring yourself and so forth, that's really not a problem. In terms of the complications of the operation, these operations are elective procedures and they're done on healthy patients, not sick patients, so medical complications are really very rare. There are some cosmetic complications that can occur, and a lot of that has to do with what you start out with in terms of the quality of the skin a patient has. And those are certainly discussed at length when you come to see a plastic surgeon about it.
And I think you have to realize that everybody who has plastic surgery, there is always the chance that something is going to go wrong.
Oh, absolutely.
And you have to make that clear, that that is always a possibility.
Right.
And that's it with any operation.
You know, we're not perfect. We're perfectionists. We're not perfect, and neither are people. And we try to do our best with everybody. We try to make sure patients are well informed. And the majority of cosmetic surgery patients do very, very well with no complications or minimal complications. And that's why so much cosmetic surgery is done, because it is safe.
Let's go back to the phone. Good morning. You're on with Dr. Wojtanowski. Hi.
Good morning. What caused the fat to be there in the first place, and will insurance cover this?
With respect to insurance, no, because this is elective cosmetic surgery. With respect to why is it there, it really has to do with genetics. There are certain people who are predisposed, especially the areas we've talked about, the love handle in the male breast, the saddlebag area in women. There are some women who weigh 90 pounds who have a saddlebag, and their mother and their aunt and their sisters all had it, and other women who don't have those. And so it really has a lot to do with genetics, what you inherited from mom and dad.
Yes.
I would like to know about a woman that's in her middle ages and has an apron of fat. That's what the doctors call it, an apron of fat.
Right, that's exactly what it is. What you can have is a combination procedure whereby you have a standard so-called tummy tuck procedure where we remove the excess skin, because there is a lot of excess skin, and we combine that with fat removal either by cutting it out or by suctioning. And it's a very, very common procedure, and people in that